Hello, everybody. Thank you and welcome to Black Girl Health, the New Jersey chapter. I am KD Golden Voice, your host, and I have my special guest, Sandra Battle. She is a Black Girl Health professional. Thank you so much for coming in and joining us here on Black Girl Health. We're going to discuss tonight. It's just a happy hour. This is a laid back discussion. I was letting the ladies know, that you don't worry about, we don't have any slides. You don't have to pull out your laser pointer. We're just going to be relaxed. And we're going to be discussing the coronavirus and its effects on everyone. And I'm just lucky enough to be able to contact some people who are in the healthcare field and just, go back and forth with them. Now, Robin Brown was the other health professional. She did give me a call. Of course, she's always on schedule. So she called me beforehand to let me know that she was running over. She did let me know that sometimes in that doctor's office, they can run a little late. So she let me know she was there. She was running a little late. She was going to try to get here, before the happy hour is over. So we hope she's done. She's doing well, and she's being a healthy Black girl. So we will talk to her as soon as we can. Thank you so much, Sandra, for meeting with me. And you are a health professional in the pharmaceutical industry.
That is correct. Thank you for having me. That's correct. I'm a biologist in the pharmaceutical industry. So,
thank you. All right, Schmancy. Okay, so I'm so glad you took this time. I know you're very busy. Thank you for being with me. And we're just going to discuss COVID-19, how it's been affecting everybody, especially the Black community. We'll get to that later on. So the first thing I just wanted to bring up, I brought up some questions and answers from the Britannica company, so because I didn't want to guess or go off the top of the head. So the first thing I just wanted to state is that the question is, what are COVID-19 and SARS-CoV-2? I hope I'm saying it and pronouncing it right. So COVID-19, coronavirus disease 2019, is a respiratory infection first identified in Wuhan, China in December 2019. It is caused by a novel type of coronavirus named SARS-CoV or CoV-2, severe acute respiratory syndrome coronavirus 2. Viruses and the disease they cause often have different names. So that's the medical, functional term for COVID-19. It's horrible. It's been affecting a lot of people in all communities, but especially we're going to discuss the Black community. What have you, since being in the medical field, like you're on the inside, like you've been, and let me ask you, how long have you been a biologist or working in the medical field?
So I've been a biologist now for 15 years.
Wow.
For 15 years, I've been in pharmaceutical. Actually, I've been in pharmaceutical maybe 20, so a little bit before, but then I transitioned over into the research area 15 years ago, actually 15 years this year.
Whoa, 15 years this year. That's a long time to be working in any field. It's hard.
Yeah, my background is mostly in large molecules, which are proteins. Obviously, at my company, we do have a vaccine area. That's not my expertise, but however, just biology in general and overall, when we're talking about the proteins of this virus and things like that, we have a little familiarity with it. And obviously, we all have gone through, what's happening now and just trying to cope with how do we handle it. So, this is a great talk, to have and understand how people are coping.
It really is. It really is, because I myself don't know, because I didn't go to get tested myself, and I have not myself gotten the vaccine. But since your company does have a vaccine, do you know just at least one or two places where ladies in New Jersey may be able to go if and when they want to receive the vaccine? Do you know some sites that they may be able to?
So I don't have sites on hand. So my company is not making the vaccine. Okay. So they're not in this race. They've taken their hat out of this race. Okay. And that was just based on some data that came back. It just did not look as good as what's already out there. And so it just wasn't worth pursuing. So we took our hat out of the race. However, what I did find out is that you can easily just actually Google, where can I get a vaccine? And so within New Jersey, the counties are set up with service locations, right? And so what you'd have to do is you need to sign up. You put your name on the list. They will email you when it's approaching your time to make an appointment, and then you can go in and get the vaccine. So that's pretty much county wide how New Jersey is handling it. I mean, it could be different in other states, but at least with New Jersey, if you just simply type in, where can I get the vaccine, that will come up, and it'll come up in a county form. And so there are also pharmaceuticals, I'm sorry, not pharmaceuticals, I apologize, pharmacies that are also receiving distribution now, but they're still operating the same way, where you would pretty much sign up, you have to sign up, and then you'll be emailed in a particular order, right? In the order in which they receive you. And so that's how they're starting to distribute the vaccine. Now that they've pretty much dealt with a lot of the first line responders, and they've dealt, with all the medical staff and things like that, and the elderly, so now they're starting to have people sign up.
Regular, just everyone else now.
Yes. Yep.
Thank you for that information. That's good, because I'm basically just dealing with New Jersey. Black Girl Health has offices mainly in Pennsylvania, a lot of different places in Pennsylvania. And I'm actually the first ambassador for the state of New Jersey. So I'll be basically focusing on where they can get access to whatever, healthcare, wellness, beauty that they're, that they want to access in New Jersey. Okay. So that's awesome. So if they could just Google it, it goes by county, and sign up and check your emails, and they'll get back to you. It's the long lines and the chaos, it seems like it's been dwindling a lot. Yeah. So it looks like that's getting better. Yeah. So that's awesome. Moving on, I just wanted to go to the next question. They're saying on the Britannica, it says, how does the virus compare with SARS, MERS, influenza, and the common cold? And they state coronaviruses usually lead to mild upper respiratory infections such as the common cold. However, 3 times in the last 18 years, coronavirus outbreaks have caused serious disease across the world. SARS in 2002, MERS in 2012, and now COVID-19. The seasonal flu is caused by any number of types of strains of influenza virus and altogether different family of viruses. Now, the World Health Organization lists the similarities and differences between COVID-19 and influenza. So if you want to get technical information that has been fact-checked, you want to go to the World Health Organization, I believe, .org. World like WHO.org, World Health Organization.org. So you get your pertinent information from them, a likely source. And unlike COVID-19, influenza has been studied by scientists for decades, and a great deal is known about the symptoms, risk of infection, and ways to treat the seasonal flu, because COVID-19 is fairly new. It's still being studied, still being researched, and so we're still getting information that's coming out. So you definitely want to go to real professionals, real people who understand, like Robin was stating, infectious disease doctors, to get answers to your questions, because it's really important. Because I thought that, like myself and my family, I believe, because I didn't go get tested, that we could have had coronavirus before it really hit, because the symptoms. Okay. It was right, because it was, let me say, around, if it came out in 2019, like around, did they say December is when it first said? Is that what? Wow. And everything really hit like in March. I remember that's when everything. Okay, so it had to have been before that. So it was 2019. It had to be around like about October, November. Okay. And it felt like a cold, but it was to the point where, because first my supervisor had a terrible cough for a long, long time, and she got checked and they didn't know what it was, and put her on antibiotics, put her on this, put her on that. And it was horrible. And right. I'm like, oh my God, what's wrong with you? And it was almost a year that she had this hacking crazy cough. Then I got this cough, and Then my husband got the call. Then my son got the call. And it was to the point where it was changing. It would be like, mucousy and phlegmy, and then it would be dry and you cough so much that you lose your breath, and you can't breathe. And it was to the point I'm like, what is this? It was like nothing. I've never felt anything like it. My husband coughed and passed out to the point he couldn't catch his breath, passed out, came back. Like, but what we do, we drank tea.
Drink tea and lemon and honey. Yeah.
And honey,
yeah,
and
cure
all
everything.
the natural stuff that I'm used to, because even if I would have gone to the doctor, they wouldn't have known.
No, well, and it's a virus, right? So there's no medication for a virus. Your body has to fight that virus off, right? So I mean, there's medication to give for other symptoms and give you relief there, but a virus has to be fought by the body, right? And so there's really nothing that they can give you for the virus. They can give you things to treat symptoms, but the relief of the virus, your body has to fight that off. It has to develop those antibodies to fight that. Yeah.
Wow. So I'm hoping that I've developed the antibodies, if that's what we had, because I've never had any type of, and I've been super duper sick from the flu before. And we're the old school family. We'll treat whatever it is. If the bone ain't sticking out, we're not taking it to the hospital, basically.
Yeah.
But I got the flu one year, and I was super like healthy the day before. I mean, I felt better than ever. I'm like, wow, I feel good. I had to be about 17 years old. I felt super good. The next day, I'm going to get up. I'm like, I could not move. I could not move out of the bed, to the point where I'm like, Mom, I couldn't move. She goes, what's wrong with you? I'm like, I can't move. I was so sick. That was the flu.
Wow. Okay.
That was the flu. That wasn't even anything like this was.
Yeah.
So I'm like, this is.
It definitely has. It has some very similar symptoms, but COVID is a bit different. Yeah, it definitely has its own little special symptoms that are slightly different from the flu. But I mean, a lot of the times, if people are experiencing mild symptoms, then it does resemble, the flu. So you need to get checked in order to really confirm, if you are actively infected or have you been recently infected or whatever that is. Yeah.
Okay, that's good information. I know. I definitely want to say my heart. What's that? Oh, is she?
Yes.
Oh wow, where is she? How can I get her on the camera? There she is.
She's been on for a while. I was waiting for you to cue her in.
Oh my God, I didn't see her. You know why?
But her audio's not working on
screen. Let's see. Can you unmute?
Are you muted, Robin? Because it looks like you're talking, but we can't hear you.
I can't hear. There she is.
Can you hear me?
Yeah, there she is.
I can hear you. Hello.
Hi, everybody.
Hi. Thanks so much for joining us. Hey, superhero. Look at you.
I'm not a superhero.
First responder.
That's right. Look at that.
I
salute you. Man, let me tell you. You guys are awesome. Look at you. You made it. Thank you. Look at that.
I just got in and I was trying to do everything while I was driving, which was not a safe thing to do.
No, come on now. Miss, cross your T's and dot your I's now. What's going on now. Be safe. You have to be safe. Yeah, well, thank you for joining us. She made it. This is Robin Brown. She is another Black girl health professional. She works in the nursing industry. She is the superhero on the flyer. Well, she's the lady standing in front of the superheroes on the flyer. And we were just basically going through the symptoms and the find out what that was, the symptoms and everything of COVID, and talking about where people can go to, like get the vaccine if they want to get it.
Right.
Sandra did advise us that it goes by the county now that the first responders and the elderly and things like that, the people who need it the most have gotten it, mostly mainly, that it's coming out to the rest of the public. And pharmacies have it, and you have to get signed up. and you have to, it goes by county, you got to get signed up and you go for your appointment. It's a
Right.
2-dose, correct? Because I do know that you got yours. It was a 2-dose, right? Now, let me ask you, because you did go somewhere, what was the actual facility that you went to?
Well, for me, it was my job. I work for St. Peter's University Hospital. And so frontliners got theirs at the hospital, and mine is done. I did everything in January. And for me, it was Moderna. With Moderna, you have to have 2 doses. And I was done in January. Now they have J&J that's coming out with 1 single dose, but the others are still 2 doses. But for me, it was at the hospital. The hospital is now opening up vaccines to family members, your husband, your immediate family. If you have in-laws over 65, they can come in. So now they have a website that you can go on, but the website it's already shut down because it's already booked. And state, so you do have your state, so you can just go on to your state website, and they too are taking reservations for your vaccine, but they're still doing parts. I don't know if Johnson & Johnson is going to be a part of the states. It may very well be, but I'm not sure.
Oh, okay. All right. All right. So interesting. All right. So I have not gotten the vaccine. Sandra, have you gotten the vaccine?
I have not.
Okay. So we got 2 that have not yet and 1 that has. Now, Robin, how did the vaccine go for you? And how, how far apart were the doses? How did you feel? Were there any symptoms? Were there any side effects?
Well, no, I didn't have any side effects. Well, the only problem is that it's just like when you get a flu shot. You have the pain at the injection site. The first dose, I was fine. The second dose, however, I did have sort of flu-like symptoms. I had a fever. It was 100.1. I was feeling, I had malaise, I had body aches, the same feelings that I had when I had once experienced having the flu. But it started about 5 o'clock in the morning, I guess, because I had the vaccine on a Sunday. So Monday there was a snowstorm, so I didn't go to work, which was a good thing. I wouldn't have gone anyway because I had a fever. And by I would say about 9 o'clock, 9:30 that night, I started to feel a little bit better. So fever, the chills, the aches, the pains, all that was gone. All I had was, pain in my arm, and I just rubbed that down with like witch hazel, and I was fine after that.
Okay, cool, good. Glad you're all vaccinated and feeling well, that you didn't have any side effects. That's awesome. We're on to the super girl. Now this is the next question from Britannica. I'm just reading through some good questions from Britannica. Instead of trying to just come off the top of my head, I wanted some FAQs and some good information, some good researchable information that people can go back to. So this is from Britannica. It says, how does genetics impact our understanding of COVID-19? And it states that, excuse me, in January 2020, researchers published the first sequence of the viral genome responsible for COVID-19. Within a week, the sequence information was used to develop a test to detect the presence of the virus. Additional genomic studies showed that the virus was similar to, but distinct from, the viruses responsible for SARS and MERS. Sequences from several of the earliest patients in China were nearly identical, suggesting that the virus had only recently entered the human population. As the virus has spread, certain strains have acquired genetic changes. By sequencing the virus of different patients, these genetic changes can be compiled into a viral family tree and used to track disease transmission. Other researchers have used the genetic sequence to identify ideal traits for vaccine development. So that wasn't,
I mean, it's just basically explaining that, the genetic impact. So at that time, probably when you pulled this information, there weren't that many people infected, right? And so the virus pretty much sequence looked the same. But now that we've had millions of people, infected by this virus, it starts to mutate because it's going to respond and it's going to be received in everyone's body a little bit differently. So now we're seeing these variants of the virus. And so early on, what this paragraph is saying was early on that it was new. You can tell that it was new because there had not been any mutations happening at that time. Now, fast forward a year and a little and some change later, yeah, there's some variances out there now. So many people have been infected. There's several variances out there. So they use the genetic material to sort of track and try to tell where the infections are spreading from. So that's how you sort of keep a host, and that's how you develop a vaccine, right? Just like the flu, there's so many strands, right? And so the only way to do that is to collect that information when people are infected so that you can build the next vaccine to include that strand, so that's why with flu, you're always like a year behind the newest strand, right? Because it takes time to collect that information, make a product that's going to now attack that virus. So that's basically what that's saying.
Yeah. Well, I'm so glad you explained, because I'm like, I read a whole lot and I don't know what that. And I think I'm pretty smart. I'm like, well, see, that's why medical, that ain't my type of reading, because Lord, my head was about to explode. And I'm like, I read and understood all the words, but how they put it together now, I'm completely confused.
That's all it meant. That's all.
Decompressing that, because that was a mess. Oh, wow. Hold on. I lost my screen. Okay, here you go. So the next one, this is the one I think that I was thinking that question was. So are specific groups more at risk for COVID-19 than others? Most confirmed cases of COVID-19 have occurred in adults. Infections have been reported in children of all ages, but the data suggests that older adults age 65 and above are higher risk for serious COVID-19 illnesses. The risk may be twice as high in these populations, possibly because immune systems change as people age, making it harder to defend against disease and infections. Individuals with certain set of pre-existing health conditions, persons with chronic lung disease, heart disease with complications, severe obesity, diabetes, hypertension, renal failure, or liver disease, or those who are immunocompromised. Who are also at risk for several illnesses for COVID-19. Data released by the Centers for Disease Control and Prevention for March 2020, the first month of the WHO's declaration of the pandemic, show that people who were sick enough to be hospitalized, nearly 90% had at least one chronic condition. So that's basically what you were saying, different people, react differently. So that they have more information now than they did at this time. But when it gets to additional data suggests African Americans are disproportionately affected by COVID-19, excuse me, and more likely to be hospitalized or die from disease. Racial and ethnic demographic data are not always publicly reported, and there are gaps in this information from state to state. Regardless, the available data suggests that the increased frequency of infection and poorer outcomes are being driven by historical inequities in job opportunities, housing, dentistry, health risks, and access to healthcare. So that's basically always, what the issue is with all diseases, that's, these that can, heighten the negative effects of any disease. So what we need to do is get some wealth in the Black community so that we have access to the healthcare that we need and we want. So that's what we really need to do. So
yeah, I think that question was like a two-part question, right? Because I think it talked a lot about, which Robin would probably know more than all of us, the from the patients that have come into the hospital, right? What the age groups are, or the underlying conditions and things like that. But like you said, in terms of the disparities for our area, it's always, we live closer together, right? Our houses or apartments and things, we're on top of each other in poor neighborhoods. We don't have the access to healthcare, or at least adequate healthcare, right? Most of us probably don't have insurance, so we don't even go to the doctor. And then when we do go, the clinics and doctor's office maybe are poorly managed and things like that. So you're already, fighting an uphill battle. And then, obviously, when you are less fortunate, you probably have poor eating habits and other things, right? That are going to compromise your system already. So it's just like a domino effect that, it's inevitable that, when something like this happens, that when you're talking about a poor community that's already close together, eating poorly, not getting the health care on a regular basis, they're probably going to have the biggest impact.
I mean, that's what it is. I mean, that is what it is. But yeah, Robin absolutely would know because she actually is on the front line. So, like, let me ask you, like, how, goodness gracious, how has it been? And how has it changed from, I guess, from March last year? This is a year now. It's March this year. From March last year, when everything started being shut down, the masks started, having to be worn. How did the hospital, and not just the hospital, because you're not working directly in the ER anymore, but as far as your contact with patients, even though, it's not directly in the ER anymore, your contact with patients, you understand what's happening, what's going on. What have you seen? What has changed, that you've seen in the last year?
Well, I don't have the direct contact I have with patients is in my clinic. And even when I'm working my part-time job, the patients are on the floor. So I'm specialty, so I do wound care. But what I have seen most is I always seem to work the floor with the patients on the ventilators. So with regards to COVID, the ventilator floor has been more than what I've ever thought I would dream to see in my whole entire life. So there have been, during the height of COVID, patients on ventilators was the top priority in the hospital. I do the wound care. If they've been on ventilators for 20, 30 days, then clearly we have got to start assessing the patients for pressure wounds. And in addition to the COVID, now they have pressure wounds that we're taking care of. So with regards to that, I can only speak for that the floor patients, the amount of admissions had probably quadrupled around that time. So much so that they went from opening up a whole nother wing in the hospital where I'm part-time so that they could add more patients for more ventilators. So COVID COVID was really something that none of us would never thought that we would experience in our lives. And to take care of the patients that are also COVID positive was a lot of work because you have to make sure that you have your N95s on in the hospital. We have to wear the proper PPE. The patients are in rooms with negative pressure. So you have to go through what's called a vestibule, so to speak, when you're going in and out. So it was a lot.
Wow.
It was a lot.
It's a lot on your mind. It's a lot on your body. It's a lot on your spirit.
Yeah.
God bless you for just being there on the front line. Cause I can tell you, I can't do it. It ain't for me. No.
It has to be a passion.
We found that we were sitting, like the nurses were overwhelmed, the hospital was overwhelmed, the staff is overwhelmed. You're washing your hands so much. A lot of us our hands were raw from taking care of patients. It was a lot.
How has it changed now? Has it gotten better?
Well, you get your peaks and your valleys. So when they start to loosen some of the laws about, mask wearing and adding more people into areas, that's when you start to see a spike again. All I can say is that wearing your mask and keeping your social distance seems to be what keeps the numbers down. People don't want to hear that. Humans as overall are social people, but they understand that we are still really in a big pandemic. The number of deaths are not the same, but the number of people getting sick is the same, is still high. Yeah. So we really have to use our common sense. People have to stop arguing about, whether or not they want to be immunized, whether or not they want to wear masks, whether or not, they want to social distance. The bottom line is that with viruses, you need to follow all those protocols that the CDC tells us to. I understand they want to make money, but if you want to make money more than you want to preserve human life, then you're going to have a problem there. So I advise personally that we wear our mask, we social distance, be cautious, just, you got to try to ride this one out, because this is not something that we've ever seen before.
True. I couldn't have said it better myself. I'm so glad you came in because, I wanted to make sure I had the two people from two different, because listen, you said you're not you're not an infectious disease. I'm not, a professional, but you just enlightened us to something that you don't even think about. The people that are on a ventilator, they get wounds. Like who, that doesn't come to someone's mind. There's so much that goes into, the medical and caring for people, and just, it's just whatever it looks like on the surface. There's so many, underlying other things that, are done. And I knew that you guys could touch on some things that I hadn't even thought about or fathomed. So I really appreciate you taking the time out to come on in. I'm not going to keep you guys for too much longer. I did just want to reiterate that Black Girl Health is running for the month of March. If you become a member of Black Girl Health, the lowest membership is only $24 for the year. You get all the perks of the discounts to the BGH merch. Oh, for March, let me just say, for March, you get a free gift. So when you use the code KD Golden Voice /REIGN, that's like a Queen's Reign, REIGN, you get a free pack of non-toxic feminine pads. So you get that extra on addition to the membership perks. So you have access to health and wellness guides, workouts, meal plans, merch, and so much more. You have access to private events and things like that. And like I said, partner members have, different networking events. If you have another company that you're working for on your own, your side hustle, your side gig. So we have a lot of different great opportunities for Black women to have access to all types of health, wellness, and beauty to enrich their life. So, come on over to Black Girl Health, check us out. And look at all these Black girl health professionals. They're doing big things. We thank you so much. Thank you so much. Talk to you guys later. Have a lovely evening. Happy Friday.
Bye, everyone.
Thank you. Bye.
Thank you.
Love.
Love.
Bye.